Welcome to the deep dive. We're tackling a really critical area today, something absolutely crucial for anyone involved in child health, shaken baby syndrome.
Or abusive head trauma, as it's also known.
Exactly. If you're looking to get a solid grasp on this, very serious condition quickly and effectively, this is the place to be,
That's right. We've basically distilled the essentials from our pediatric revision notes.
giving you that high-yield understanding.
Yeah, exactly. So our mission today is to cover what you need for efficient learning and recall. What it is, the causes, risk factors,
How it harms, diagnosis, what it looks like.
investigations, treatment, prognosis, complications, the whole lot, really. Designed for, quick but thorough comprehension. Let's jump in.
Okay, so let's begin with the basics. What exactly is shaken baby syndrome? How do we define it?
Well, at its core, shaken baby syndrome, or SBS, is a severe form of child abuse.
Right.
It results from forcefully shaking an infant or young child, and that leads to significant, sometimes devastating brain injury.
And there's that triad people talk about.
Yes, the triad. It's a key indicator, often mentioned. It consists of retinal haemorrhages, that's bleeding in the back of the eyes,
Okay.
subdural haematoma, which is bleeding on the surface of the brain,
Right.
and encephalopathy, which basically indicates brain dysfunction. Remembering that triad is pretty important.
And the typical age range we're looking at.
It primarily affects the very young children between 0 and 5 years old.
Now, I've heard that diagnosis isn't always straightforward,
Hmm.
especially in legal settings. Why is that?
Yeah, it can be complex. You really need to carefully differentiate SBS from other conditions that might, present similarly.
Such as?
Well, while the full triad is strongly suggestive, finding just one of those things might happen in other medical situations. So a really thorough investigation is essential, which understandably makes legal interpretation tricky sometimes.
Got it. Let's move on to how this actually happens, the etiology, what causes it.
The primary cause, no, it's in the name, isn't it? Forceful shaking of an infant or young child. This might be intentional abuse, or sometimes, perhaps more rarely, it could stem from like a violent reaction that wasn't necessarily intended to cause that specific harm, but still involved shaking.
And what's often the trigger for this kind of shaking?
Sadly, it's frequently linked to a caregiver reaching a breaking point. Frustration, loss of control, often when faced with a baby crying inconsolably or other challenging behaviors.
So how does the actual act of shaking lead to the brain injury? What's the mechanism there?
Okay, so the violent shaking causes the baby's brain, which is quite soft, still developing, and has more water content.
Mm-hmm.
It causes it to move rapidly back and forth inside the hard skull. Think of it bouncing.
Ooh.
Yeah, this rapid acceleration and deceleration, especially the rotational or twisting forces involved, that's what causes the damage.
That sounds incredibly dangerous. Are there certain factors that might make a child more vulnerable, or perhaps caregiver characteristics that increase the risk? Let's talk risk factors.
Yes, definitely several important ones to be aware of. Age is a huge factor. Infants under 1 year old are the most vulnerable.
Under one.
Yeah, and there's even a peak incidence typically cited between 2 and 4 months old.
Wow, that's specific. Why then?
Well, think about it. Very young infants have weaker neck muscles, less control over their heads, and their brain structures are just more fragile.
Makes sense. What else?
Gender seems to play a small role. Boys are slightly more often identified as victims, though it affects both sexes.
Okay.
Then you have caregiver-related factors, things like young parental age, being a single parent, maybe lacking good social support networks.
Stressors.
Exactly. And the presence of mental health issues in the caregiver is another significant factor.
And unfortunately, substance abuse often comes up in these situations too, doesn't it?
Absolutely. Caregivers struggling with drug or alcohol abuse, that's a well-documented and significant increased risk for perpetrating abusive head trauma.
Okay, let's maybe dig deeper into the biology, the pathophysiology. How exactly does that shaking damage the brain tissue and vessels?
Right, so building on the mechanism, those rapid deceleration forces, they can tear the tiny bridging veins.
Bridging veins.
Yeah, they run between the surface of the brain and the dura mater, the tough outer covering.
Okay.
When those tear, you get subdural hematomas, those collections of blood on the brain surface we mentioned. But it's not just that. The shaking can also cause something called diffuse axonal injury.
Axonal injury, like nerve fiber damage.
Precisely. It's a widespread shearing or tearing of the nerve fibers throughout the brain. very serious. And you can also get cerebral edema, which is just swelling of the brain tissue itself.
And the infant brain's structure makes this worse.
Yes, it's immaturity, higher water content, less myelination. It all contributes to its vulnerability to these shearing forces.
It sounds like there could be, other things that might cause some of these symptoms. What's the differential diagnosis? What else do doctors need to rule out?
That's a really critical point in the diagnostic process. Clinicians absolutely have to consider other possibilities, like accidental trauma. Did the baby have a significant fall? Could it be other forms of child abuse that didn't involve shaking? Certain infections like meningitis or encephalitis.
Okay.
Also, some metabolic disorders can cause neurological symptoms, and you always have to consider any pre-existing medical conditions the child might have. Ruling these out is key.
It really sounds like putting together pieces of a complex puzzle. How often does this actually happen? What's the epidemiology look like?
Yeah, getting exact numbers is tough.
Why is that?
Mainly due to underreporting, and also some variation in how cases are diagnosed and classified across different places.
Makes sense.
But estimates generally suggest an annual incidence of, well, several hundred cases of abusive head trauma each year in developed countries. It's a significant issue, even if the precise numbers are hard to pin down. Likely underreported, as you might expect.
Yeah, a sobering thought indeed. Okay, let's shift to how SBS might actually present clinically. What signs and symptoms should make someone suspicious?
The presentation can really vary, but some common signs include things like excessive irritability or crying that's just really hard to console. Lethargy is a big one, a noticeable decrease in the baby's responsiveness, difficulty breathing, maybe even apnoea, or sometimes seizures.
Those sound quite serious, but maybe also a bit general for babies sometimes.
Yeah.
What else might really raise a red flag?
You're right, they can be nonspecific individually. Other things to look for are poor feeding or vomiting, maybe significant changes in the baby's usual sleeping patterns.
Okay.
A bulging or tense fontanelle, that soft spot on the top of the head, that's a classic sign of increased pressure. Also, pay attention to the eyes' inability to focus, unusual eye movements, any visual disturbances.
And in severe cases?
In really severe cases, you might see unconsciousness or even a full coma.
That's quite a list. Is there a helpful way to kind of crystallize those features in your mind for recall? Like a memory aid?
Yeah, we could try one. Think of a baby who is profoundly unwell. Maybe think irritable, lethargic, feeding problems, fits or funny breathing, bulging fontanelle, and eye signs. Maybe ILFFBE. It's not perfect, but grouping them helps. Think distressed, unresponsive baby, feeding issues, maybe seizures or breathing trouble, and check that fontanelle and eyes.
ILFFDE. Okay, that could work. So if a clinician suspects SBS based on these signs, what investigations are typically ordered to confirm things and rule out those differentials we talked about?
Right, a comprehensive investigation is absolutely crucial. It usually starts with brain imaging.
CT or MRI?
Often a CT scan first, especially in an emergency setting. It's quick and good for spotting acute bleeding, like subdural hematomas, and also any skull fractures. An MRI might be done later, maybe once the baby is more stable. It gives much more detailed pictures of the brain tissue itself, helps see diffuse axonal injury better, and can sometimes help age the bleeds.
Okay, so for someone studying maybe for the MSRA, what kind of brain bleed are we most focused on finding on that scan?
The classic finding, really, is the subdural haematoma, that bleeding between the dura and the arachnoid layers covering the brain. The pattern and location of these bleeds can be highly suggestive of a shaking mechanism, but they also look for brain swelling, cerebral edema, and other types of bleeds, too.
And what else is part of the standard workup? It's not just brain scans, right?
Oh, definitely not. An ophthalmologic examination is vital. An experienced eye specialist needs to look for those retinal haemorrhages we keep mentioning.
Right.
Then a full skeletal survey is usually done. That's a series of x-rays covering the baby's entire body.
Why the whole body?
To look for fractures, not just new ones, but also healing fractures, older injuries. Finding multiple fractures of different ages is another strong indicator of non-accidental injury.
Okay.
And finally, various lab tests, blood work, maybe checking clotting factors, sometimes a lumbar puncture to check the cerebrospinal fluid. These help rule out infections, bleeding disorders, metabolic problems, and other medical mimics.
Right, covering all bases. So once SBS is suspected or confirmed, what's the immediate medical management? What are the priorities?
The absolute first priority is stabilizing the infant. ABCs, as always.
Airway, breathing, circulation.
Exactly. This might mean securing the airway with intubation, maybe mechanical ventilation if breathing is inadequate.
No.
Controlling any seizures is critical, usually with anti-epileptic drugs.
Yeah.
And in cases with significant brain swelling or large hematomas causing pressure, neurosurgery might be needed urgently to relieve that pressure.
Okay, stabilize the baby first. Beyond that immediate medical care, what are the next essential steps?
Well, this is crucial. Child protection services must be involved immediately.
Right.
They need to initiate a thorough investigation into the circumstances of the injury. This is vital to ensure the child's ongoing safety and to understand the nature and extent of the abuse.
And thinking longer term, what kind of care do these children need?
Long-term care is often complex and requires a whole team. It usually involves rehabilitation therapies, physio, occupational therapy, speech therapy.
To address deficits.
Yes, to help with any physical, developmental, or communication challenges resulting from the brain injury. Ongoing developmental support is key to help the child reach their maximum possible potential. And of course, regular monitoring of their growth, neurological development, vision, hearing. It's a long road.
Is there a simple way to remember those management steps?
Maybe think. Stabilize, protect, rehabilitate. Stabilize the child medically first. Protect them by involving the appropriate services. Then focus on rehabilitation and long-term support. SPR.
SPR.
Yeah.
Stabilize, protect, rehabilitate. That's helpful. Now, the prognosis. Sadly, I imagine it can vary quite a lot.
It really does. The outcome heavily depends on how severe the initial brain injury was and also how quickly and effectively the medical interventions managed the acute phase. But tragically, many infants who survive SBS face lifelong disabilities.
What kind of disabilities are most common? If someone asks, say, in an exam context, what are the big long-term challenges?
The big ones are often cognitive impairments, problems with learning, memory, attention, executive function. And motor deficits are also very common, affecting movement, coordination, balance, potentially leading to conditions like cerebral palsy.
So cognitive and motor.
Those are often the most prominent, yes. But also sensory impairments like vision loss from the retinal damage or hearing loss, and developing epilepsy or other seizure disorders is a significant risk. Plus, behavioral and emotional difficulties are quite common too.
Are there any factors that can, maybe improve the outlook somewhat for these kids?
Yes, thankfully. Early recognition of the injury is key. Prompt, effective medical care makes a difference. And then access to comprehensive supportive services, early intervention therapies, good educational support, and crucially, a stable, nurturing environment going forward. These can all positively impact a child's development and overall prognosis, even after such a devastating injury.
Okay, and let's talk specifically about the long-term complications they might face as they grow. Can we break those down?
Sure, we've touched on some, but let's list them clearly. Neurological disabilities are a major category. This can range from mild learning difficulties or ADHD-like symptoms, right up to severe intellectual disability and significant physical impairments like cerebral palsy.
Okay.
Visual impairments are common, sometimes even leading to legal or total blindness due to those retinal hemorrhages or damage to the optic nerve or brain's visual pathways.
Right.
Hearing loss can occur if the auditory system is damaged. Seizures, as we said, can become a chronic issue, leading to epilepsy. And then there are the behavioral and psychological problems, things like difficulty regulating emotions, aggression, anxiety, attention problems, major challenges with social interaction, and forming relationships.
It really impacts every aspect of life.
It absolutely can. And we have to mention, tragically, in the most severe cases, SBS can be fatal, either acutely or from later complications.
That's just heartbreaking. Is there a way to perhaps categorize or remember these potential long-term complications?
Let's see, maybe think about the major areas affected. You've got the nervous system generally, so neurological disabilities, cognitive issues, seizures. You've got the senses, primarily vision and hearing loss. You've got motor function deficits. And you've got behavioral and psychological issues, maybe NSMB, nervous system, senses, motor, behavior. And always remember the risk of mortality.
NSMB, nervous, senses, motor, behavior. Okay, this has been a really important, if difficult, deep dive. To wrap up, what are the absolute key takeaways about shaken baby syndrome that listeners should hold on to, especially if they're revising?
Okay, the crucial points. SBS is severe child abuse from forceful shaking causing brain injury. Remember that triad.
Yeah.
Retinal haemorrhages, subdural haematoma, encephalopathy, though diagnosis needs care. Infants under 1, especially 2 to 4 months, are most vulnerable. Understand the mechanism, acceleration, deceleration, tearing veins, axonal injury.
Right.
Know the key clinical signs, irritability, lethargy, feeding, breathing issues, bulging fontanelle, eye signs. Remember the crucial investigations. Brain imaging, CT MRI, eye exam, skeletal survey, labs. And finally, grasp the management priorities, stabilize, protect, rehabilitate SPR, and critically recognize the potential for severe, lifelong disabilities across multiple domains and SMB, underlining why prevention and early intervention are so vital.
Absolutely. It's so clear that understanding SBS, its devastating impact, is vital for everyone in child health and welfare. If you want to solidify this knowledge, especially for MSRA prep, definitely check out pastmsra.com.
And freemsra.com as well, both excellent resources.
They really are. This whole discussion just underscores the profound vulnerability of infants, doesn't it?
Yeah.
And the absolutely tragic consequences when that vulnerability is exploited through abusive head trauma.
It really does. By understanding SBS better, hopefully we can all contribute, in whatever our roles are, to protecting these young lives. It's a collective responsibility.